Something makes you blush? Guess what? You've come to the right place because today we're tackling some of your most embarrassing questions. And this next one, it comes from Netta, who has a concern about something back there.
I love running. I run every day, but I tend to chafe in the rear end area.
It's really uncomfortable.
Is there something that I can do to help fix it?
Netta is backstage with Dr. Orden and dermatologist Dr. Ava Shamban to give her a little chafing advice. Take it away.
You got it. Welcome, Dr. Shamban. Always a pleasure.
Always a pleasure.
And Netta has a bit of concern. I mean, a bit of concern that we want to talk about because you're not alone here. We all get a little chafing there from time to time. So tell us what we need to do, Dr. Shamban.
Well, in people who are very athletic, like I'm sure you look like you're a super athlete, a lot of times you can perspire back there. And so it's very important to take some measures to prevent that perspiring turning into a rash, kind of like we talked a little bit, like almost like an adult diaper rash. So one thing is be sure to check out some underwear that wick moisture away when you're running. The second thing is that you can use baby powder, just like in babies, so that helps prevent chafing. When you come in from a run or from whatever athletic pursuit you're doing, you can use a very low-strength benzoyl peroxide wash. It reduces bacteria, which actually can help contribute to the rash. You want to get rid of that with a benzoyl peroxide wash. And lastly, when you come out of the shower, use a hairdryer back there. Might be kind of an interesting sensation.
Are there any fabrics, shorts, or pants that can help reduce the chafing?
Yes, go to an athletic store and ask them. There are definitely new fabrics that wick moisture away. Okay. So,
cool. Thank
you. Your
right.
bottom will be just nice and dry.
I think you've been fixed. Well, and we have Brittany. She also has a concern about something back there.
I know dimples on the face are cute, but dimples on the butt, not so much. Why do I have these? How can I get rid of them?
And Brittany is here with us now, and you are very brave to do this too. Shall we take a little peek?
I'm ready.
I like the dimples on your face.
Yes.
All right, so, you know, typically, if you have some irregularity in your derriere area, you think either cellulite, which most women have a certain degree of, or there are congenital dimples that we see more higher up on the sacrum.
Correct, yes. So cellulite is actually an issue more for women than for men, and it has to do with the connective tissue. So people who have cellulite, the connective tissue is an open mesh and it doesn't keep that fat next to the muscle, which is why men have a tighter connective tissue, keeping that fat next to the muscle. So you can get a little bit that bubbles up. And the treatment for it, for you don't want to go in there and really laser. There are some tissue tightening devices that can be used, but for you, if you do the stairs, even if there's stairs at home or stairs in your office, and some weights, some squats, it's all about exercise and keeping your weight within the right limit for you.
You know, and other tips when we talk about cellulite, we know there's no cure. We call it fat that's gone wild, like you said, that's gone through that connective tissue. But I think diet, you know, having a good diet, trying to eliminate refined sugars, drinking plenty of water, but I think the key, you hit the nail on the head, is getting a lot of exercise that really focuses on your glutes.
So you want to be sure that you stay away from processed foods and anything that's going to bump your blood sugar up. Lots of vegetables, high quality proteins, and fruits. There are some creams designed for cellulite. They have caffeine in them that can help reduce swelling, but they're a temporary fix. So if you're really looking to like keep that booty up high and tight, it's all about the stairs.
And Dr. Shamban mentioned some treatments. There's some at-home things you can do. They talk about applying coffee grinds and things like that. Sea salt. Try it. You may get a little bit of improvement, but the key, it's going to be temporary.
That's right. That's right.
Thank you, doctor.
You're welcome.
Dr. Shamban, thanks so much for joining us.